Hello, I'm Norbert Gleicher, MD. I'm the Medical Director and Chief Scientist here at the Center for Human Reproduction. Here, as always, with my colleague, David Barad, who is heading up our clinical IVF program and our research program, which is quite significant. It's Pride Month, and therefore, we want to address an issue that is still of importance in assisted reproduction for the gay community, and that is what to do and how to get pregnant if one of the partners is HIV positive. We have a lot of experience in this subject here at the Center for Human Reproduction because we have over the years had many gay couples who we helped achieving their families. And very recently, we were actually instrumental in changing the rules regarding the use of sperm from HIV-positive males in New York State. And there's nobody who can talk about this better than my colleague David Barad, because it was his doing and his communication with the New York State Department of Health that really moved this. It took you quite a few months to get through.
Almost 2 years.
Yeah, but maybe you tell our listeners what was involved.
So obviously, for a gay male couple, they need a uterus to transfer their embryos to, and in gestational carriers are the rules for gametes going to another individual are controlled by rules that were made by the FDA and by the New York State
Food
Department
and Drug
of Health.
Administration, and then at the state level, the New York State Department of Health.
And
yes.
under both of those rules, for normal donor insemination, there were rules that said that the gay men could not be sperm donors. Just
Initially,
even,
yes.
Well, even still, gay men
Yeah.
cannot be sperm donors for an anonymous sperm donation. You can't go to a sperm bank and donate sperm. That's still an FDA rule.
Because obviously the concern is or was that the gay man has a higher risk of HIV infection, and the HIV virus very frequently is present in sperm.
Yeah. Well, all these rules were made before we had excellent medical treatments to treat AIDS, and we now have
Reduce the viral load, in patients with positive HIV. Yes.
People with AIDS these days are living relatively
Normal lives,
which certainly wasn't true 20 or 30 years ago when these rules were first made.
By no means, yeah.
So we had a couple come to us who both were in this sort of zero viral load range.
So they were HIV positive, but their treatment had reduced their viral load to undetectable. Yes.
And they were looking to have a child. They're actually married and together and want to have a child. And we worked with the Department of Health. We were able to send them to the Bedford clinic in Massachusetts, which has a program in which they can look at the sperm sample that's produced and make sure that the sperm sample itself has a zero viral load.
Yes, and in other words, as far as we know, this is the only laboratory in the country, actually, that tests viral load not in the peripheral blood of an individual, but in the semen sample itself.
And so you know that both the zero viral load in the blood and the zero viral load in the semen sample. And
Yes.
We work with the lab, and both of these guys provided us with frozen sperm from that lab that had zero viral load. We were able to get a policy that the New York State Department of Health produced, which allowed them on a case-by-case basis to review the data on individuals, and if they were assured that there was a zero viral load
In
in
sperm.
the sperm, that they, on a case-by-case basis, have approved this for use.
Use that sperm in gestational
And we were
carriers.
able to produce lovely embryos from the sperm, and we're in the process of preparing to do a transfer. The state did require that the gestational carrier be offered to have HIV prophylaxis,
Yeah.
which this particular carrier has agreed to do, although the risks appear to be very low in
Yes.
any case.
Yes.
So this is an interesting pathway. I know many of our colleagues are taking care of gay couples as well, but I'm not aware that anybody has actually previously taken care of HIV-positive gay men working with a
In the
gestational
city.
carrier.
Yeah, and it's very important that our colleagues know this development, because it allows them to use the same lab in Bedford, Massachusetts that we have been using for some time. And obviously, if you as a gay person out there have problems because you're HIV positive and you do not get the response that you want from your healthcare provider, if you have any questions, you're always welcome to come and see us, even just if all you need is to get an opinion and an idea of what to do next.
Yeah, we could help point you to the guidance and what the pathway is. It's a very clear pathway the Department of Health has outlined for people who want to do this.
And it may help that we have been in touch with them already.
Yeah, yeah.
Thank you very much for listening, and don't be shy.